Hello, I'm Will. Welcome to ResearchPod. As with other of our episodes touching on sensitive topics, I will say at the start that today's discussion includes topics of maternal health, child malnutrition, medical trauma, and child death. As terrible as the loss of a child ever is, I had only recently become a parent at the time of recording this episode myself, so I admit to some personal vulnerability throughout this discussion. That personal connection is also what made the work of Dr. Christie del Castillo-Hegyi so vital for us to cover. Her research into child well-being and nutrition, in addition to her Fed is Best initiative, flies counter to a lot of the received wisdom new parents are given. Her cause, as radical as it apparently seems, is that babies get adequate care in their early development. As for why that's controversial, let's go now to her interview to find out. Dr. Christie, hello.
Hello, thanks for having me.
Thanks very much for your time today. Could you tell us a bit about yourself and a bit about the foundation and how you found yourself in the position that you hold today?
Well, thank you. I am an emergency physician in the United States and co-founder of Fed is Best Foundation, which is an organization that arose as a result of my personal experience as a first-time mother. When I was a first-time mother, I was an attending physician. I was educated. I read all the parenting books and the current recommendations for children. And one of the most prominent ones that are told to mothers is the World Health Organization's recommendation to exclusively breastfeed from birth with no supplements from birth to 6 months. And there are multiple health benefits associated with that recommendation, including reduced infectious disease, increased intelligence, all sorts of things that are said to be associated with exclusive breastfeeding. I educated myself on how to achieve that, including reading breastfeeding books, going to the breastfeeding classes. And I had a normal, healthy pregnancy, healthy delivery. My child nursed well in the hospital as expected. And I was told to continue the recommendations upon discharge. Upon discharge, my child exhibited prolonged feeding. He started to cry more, breastfeed for longer and longer and longer into the night. And then the next day, we discovered at his pediatrician's office that he had lost 1 pound and 3 ounces from his 8 pound and 6 ounce birth weight, which we weren't told what the percent weight loss was, but which was 15% of his birth weight. At that time, or still currently, many people believe that 10% weight loss is the cutoff for normal versus abnormal weight loss. But we were encouraged either to feed more frequently or supplement. And given all the education we'd received about the dangers of formula supplementation and all of the things, and the risk of failing to breastfeed as a result of supplementation, we said, well, we'll feed first. If he gets fussy, then we'll supplement. And it never reached that point because at that point he was getting more tired. On the 4th day of life, we saw a lactation consultant and did a weighed feeding, which is where you weigh them before and after a nursing session. And after, 15, 20-minute good nursing session, we discovered that he was getting 0 mLs from the feeding. So pretty much nothing. And having studied newborn brain injury and specifically the effects of glucose, hypoglycemia and hyperglycemia on newborn brain injury, development, and all of that, I knew that 4 days of not getting adequately fed could result in brain injury and starvation. So when we got home, we fed him his first 2 ounce bottle. He fell asleep for the first time in at least 2 days. And we did too. And we set an alarm 3 hours later and found him unresponsive when we tried to wake him for his next feed. And I knew it was happening. And so I prepared a bottle of formula, which our pediatrician luckily sent us home with because I had none in the house on the advice of a breastfeeding book, and prepared it and pretty much force-fed him what we could, which woke him up and resulted in him seizing. So what happens when you have no calories and then you receive some calories, the first reaction the brain has is to seize because it's uncontrolled firing. So we rushed him to the emergency room, and there he was diagnosed with hypernatremic dehydration, which is a severe form of dehydration that can cause brain and vital organ injury and increase the risk of death. severe jaundice with a bilirubin of 24. And I suspected that he would go on to have some major, or some kind of developmental disability. And little 3 to 4 years later, he was diagnosed with multiple developmental conditions, and to this day is still severely delayed in his language, in his intellectual capacity, essentially severely disabled. And that is why Fed is Best exists, to prevent these tragic, tragic outcomes that are completely preventable.
This is part of why your work grabbed me so entirely when we started talking, is because this is something that is close to my personal experience. Mine diverged in several important ways, but there's going to be a lot of people out there, a lot of young parents and a lot of babies whose early days are going to be a struggle, and this is an important part that you say for the rest of their life, is those first 3 or 4 days.
Yes.
Could we just maybe go over some of what this might mean to other people, to look at some of global or national statistics? You've mentioned the UN recommendations, but what is the global attitude? What are the global conceptions around breastfeeding and supplementation, formula, the whole landscape that this sits in?
Exclusive breastfeeding guidelines are very well established, and they've been around since the early 1990s. And unfortunately, like with any global health policy, it's possible to make mistakes along the way. Oftentimes, people who are on committees that create global policy have a specific perspective. They come from a particular socioeconomic background. They may have different physiology. They tend to be of a more privileged status. And so often policies can be written from that very privileged status. That includes the privilege of being fully capable of producing milk at the right amount of milk at the right time. And that can create blind spots. And so this is what I believe has happened with global breastfeeding policy. The people who were involved early on in creating this policy were mostly self-selected to be of this type. They were incapable of seeing the blind spots of their policy, namely what it posed to infants of mothers who had imperfect lactation, whose milk would be delayed, whose colostrum is not enough to meet their infant's basic nutritional requirements, or that would have prolonged problems with milk insufficiency. And unfortunately, instead of looking at data and looking at the reality of what is happening within the population, their perceptions and their policies on their belief that because I didn't experience it, then this problem of insufficient milk must be rare. The rationale often is that how can our population exist if milk was so commonly insufficient? That's a false narrative. That is a natural fallacy, is what we call that. Because it didn't happen to me, it must not be happening to other people. If in my mind, the only way the human population could exist is if lactation worked perfectly, then that must be true. And then I go on and create a global policy that applies to every single human being on this planet. And they don't realize the dangers it poses to mothers who don't fit that mold. And so the reality is, when you look at the data, number one, let's go back to the beginning. What data did the World Health Organization have to determine this claim that exclusive breastfeeding is best for almost every child, and that mothers rarely have insufficient milk to need supplementation? There's not a single study in existence anywhere studying any population of mothers measuring the daily milk production from birth to 6 months to say that it is true the need for supplementation is rare. It has never existed, even within the World Health Organization's, UNICEF and World Health Organization's own policy statements. When their experts scrub the literature or look through the literature for that data, their own experts said that it was rare to find mothers to exclusively breastfeed anywhere in the population, in the developed world as well as the developing world. So here we are, their own experts say that it is rare for any mother in nature to do this from 0 to 6 months. And somehow they're saying that this is possible for nearly every mother in the world.
You've mentioned the breast is best, you've mentioned baby-friendly hospitals and 10 steps to breastfeeding success. Could you tell us, just quick terms, what those are, where they fit into current guidelines, and how they came about?
Okay, so the 10 Steps to Successful Breastfeeding launched in 1989 by the World Health Organization and UNICEF. And they describe 10 steps that we as a health system, as a society, can promote breastfeeding, having written policies, having mothers room in, a number of different steps to promote breastfeeding. But step six, is probably the most prominent of those steps, which is do not give any supplemental food or fluid other than breast milk, specifically from birth to 6 months. And so that is where our foundation's work revolves around, all the risks associated with that. The Baby Friendly Hospital Initiative was the hospital policy program that arose from the 10 steps. So it is a hospital certification that comes with training, hospital health education training or health professional training, and that basically trains health professionals to follow the 10 steps and implement those 10 steps in hospital through hospital policy.
To move from the big international efforts to a kind of a local framing for anyone listening to this who has recently gone through birth and is in breastfeeding, or anyone who might have been going to local groups, what's the role of that peer support, of having health visitors, doulas, whatever kind of informal learning and informal education, rather than receiving the dictum from on high of here is behavior that should be followed for everybody?
Well, that certainly filters down because part of the 10 steps is creating community support for mothers, which is not bad in and of itself. It's important to help mothers because breastfeeding is hard. Parenting is hard. Any kind of parenting, feeding is hard. But it's the type of support. The devil is in the details. If you are receiving support that does not match your physiology, your circumstance, your needs as a family, as a parent, then you are not getting optimal support as a parent. And so for oftentimes in prenatal classes and parent support classes, especially those that are held by hospital facilities, lactation consultants, doulas, it is generally of the breast is best mindset where exclusive breastfeeding is the pinnacle that you should be aiming for at whatever cost, and that combination feeding and lastly formula feeding are kind of second and last best. And there's not very little nuance in that message. If you feed formula, you are doing a disservice to your baby. And this is exactly the kind of messaging that results in these tragic outcomes that happen routinely now in hospitals. So dehydration, jaundice, hypoglycemia from inadequate feeding while exclusively breastfeeding, especially before full milk comes in, are the most common reasons why a healthy term newborn gets readmitted to the hospital. Yet few parents are aware that that is a known risk of this World Health Organization recommendation. And this is an outrage. Every parent should be fully informed of all their choices and all the risks that are associated with it, not just these vague risks of not being able to breastfeed and maybe risk of other health outcomes that have not been tied to temporary supplementation while a baby needs it. While a baby is not getting adequately fed, that no bad health outcomes have ever been tied to supplementing a hungry baby. But there are plenty of negative health outcomes of failing to do so when they need it. And that includes brain and vital organ injury, long-term developmental disabilities, intellectual disabilities, changes in motor and sensory. It's too many to count. And few parents are being told these realities in the pursuit of getting everyone to exclusively breastfeed. And that is unethical. That is negligent. For a while before Fed is Best, health professions gotten that this whole system of failing to inform has evolved to where even health professionals don't know what safe and unsafe is. They don't know what infant behavior is an indication of severe hunger versus versus normal behavior, because their own guidelines have normalized the signs of infant hunger, especially in the newborn period. The Academy of Breastfeeding Guidelines says that constant nursing for hours and fussing are not indications for supplementations, when those are exactly the signs of persistent infant hunger. Why do we have to wait until a child has clinically proven hypernatremia, excessive weight loss, brain-threatening jaundice, and hypoglycemia in order to be fed? That allowing an infant to even reach or cross that threshold constitutes a human rights violation. And by these acts of omission, where we don't inform parents about these risks, we don't tell them the importance of supplementation of a persistently hungry infant, that this can protect their infant from lifelong disability, those acts of omission constitute an act of medical negligence. This is a very, very serious health problem, because this is a health problem that has been created by a global health policy that never existed before it. Before this policy, the goal of breastfeeding was feeding. It is common sense. That has been the standard of human beings for all of human evolution. We evolved to supplement in response to infant hunger because bad things happened to babies who don't get fed. And so we did it by any means necessary. We fed honey, we fed animal milk. You see infants, you see old photographs of infants nursing a goat's teat, not because human beings are ignorant, it's because they didn't have safe substitutes. Well, the choice is between your infant dying or them getting a maybe contaminated source of nutrition, then you're going to choose the contaminated source of nutrition. And now we are lucky to be in a time where we have a safe substitute. We have a substitute that can allow an infant to grow to adulthood, being fully fed, having all the potential that's required that they could have if they had received breast milk alone from a mom who had adequate milk. We have those options now. And now we are exposing children to these conditions that once existed, starvation and malnutrition, because of our choice to not feed them supplemental milk. Because we have chosen, as a matter of global policy, to not feed them until they are at risk. And that is just insane. There's no other way to describe it. A mom, a high school friend of mine who was going through this after I discovered all the problems that could happen, asked me a very simple question. What does a baby need to be fed? How much milk does a baby? Do you know that answer?
Until it starts coming back up is my experience.
Yeah, okay, but before that, when you were informed by your breastfeeding class, or maybe you or your partner read a breastfeeding book, if you look at any parenting book, does it say how much breast milk does a baby need to be safely fed? And you cannot find that answer in most resources. You certainly won't find it in a breastfeeding class. They will not tell you the actual volume of milk a child requires to be satisfied and fully fed, to have their caloric and fluid requirements met, so that this doesn't happen, right? That starvation and dehydration doesn't happen. And that value is 110 calories per kilo per day, be about 2 ounces every 3 hours. That's for an average size baby. A newborn, 2 ounces. Okay, do you know how much how much of that requirement they are receiving that first day from the average mother's colostrum yield? What percent would you estimate they are getting of that total volume from colostrum alone?
I don't know if I should go very high or very low, because either way I feel like I'm going to be caught off guard. Let's say 20.
10%. So the studies of colostrum yield in the first days of life, the average healthy Caucasian mother, because the studies are is a healthy Caucasian mother delivering a term baby, produces about 10% of that caloric requirement. And then the next day it's about 33%. And then the next day after that, 66%. So it increases, incrementally until the fourth day of life, when they are able to produce the full caloric requirement of their infant. Now we're talking about that's the average. How long can a baby go being underfed? That is the question to be asked of the policymakers, because their expectation is that they can be fed and that they can safely rely on their internal reserves to make it through this period of underfeeding without sustaining brain and vital organ injury. And you would expect something as ubiquitous as this policy would have several randomized control studies with safety data, just like any drug, right? Any drug would have safety data, would have tens of thousands of participants looking at the outcomes as well as adverse effects. How many do you think there are of this policy?
If I remember correctly, you've already said 0.
The 0 was the number of women who can produce exactly what their baby needs from 0 to 6 months. But the number of studies looking at using a randomized control trial, looking at the efficacy as well as the adverse effects of the baby-friendly hospital initiative, or the 10 steps to successful breastfeeding under the World Health Organization UNICEF guidelines, have 0 studies on safety.
You have a captive population here. If these people aren't going anywhere, they are in hospital holding a baby. Now is the perfect time to just gather some data. You're gathering a lot of data. You're making records, public records, lifelong records of birth weight, name, location, that kind of thing.
And most importantly, long-term outcomes. Data already exists. So the PROBIT trial is the largest quasi-randomized trial on the baby-friendly hospital initiative. And it was conducted in Belarus. I can't remember what year it started, but 1990s, 2000s, or something to that effect. And so we have a cohort it's quasi-randomized because the way it was designed is that some cities, some hospitals were randomized to intervention, which is baby-friendly hospital initiative 10 steps recommendations, current recommendations, and some hospitals were randomized to no intervention, so standard care. And they looked at rates of breastfeeding, exclusive breastfeeding after discharge, as well as certain health outcomes. They looked at multiple health outcomes, rates of GI bugs. So this is more of a population study, a population effect. How many GI infections, respiratory infections, intelligence, BMI, diabetes, hypertension, looking up to, I think as of a couple of years ago, the cohort of babies are already 16. So up to 16. So they have the data. All they have to do is look back at that same cohort of infants and look at rates of disabilities. All they have to do is look at how many infants in the intervention group versus the standard group developed problems with either intellectual development, seizure disorders, special education requirements, any number of markers, of measures. And so, there continues to be infant formula consent forms in hospitals for parents who, let's say, for instance, notice their babies aren't getting adequately fed or feel like they're not getting adequately fed. And some parents will reasonably ask for formula, and they'll receive an informed consent form for formula that says your child is at greater risk of lower IQ, higher respiratory infections, higher SIDS, higher rates of leukemia for getting this bottle of formula. When first of all, the studies don't support that. Observational studies may show that there's a difference, but then again, there are the confounding variables that limit the validity of such associations that we find in those studies. So ultimately, what we are receiving in real life as parents going into hospital, when we're getting, receiving the standard of care treatment for our children, are warnings that are not supported by the data. And most of all, these warnings are not warning us of the worst outcomes from not giving that formula to a child who's not getting adequately fed. So that's where we are as far as the baby-friendly hospital initiative, how it plays out in the real world, and what the data shows regarding baby-friendly. It is scaring them away from the decision to give formula with a misguided belief that that's going to improve that child's health. And it's just, and then there's no consequence if that child comes back to the hospital dehydrated and jaundiced because they received that warning, because they declined formula after receiving that warning. And now they're told, oh, I'm sorry, you did in fact did not have enough breast milk and your child now requires it in order to treat this dangerous condition that they've developed as a result of our warning. So that is the problem with the whole system at this time. And somehow the training they're receiving have conditioned them to not want to know that there's a problem, a feeding problem, to reassure parents that there is no problem when there is, setting the hospitals up for lawsuits. And then, of course, these families, these unsuspecting families, are just trying to do their best for their child, setting them up for a lifetime of disability, childhood disability. And I mean, there's one parent that posted on one of our blogs, just really captured it perfectly. It feels like a life sentence. It just really captures exactly what these families are going through. And unfortunately, there's no one at the top who is, benefiting financially or professionally, who is liable for these cases, who get sued: the hospitals and the health providers, not the people who are guiding the hospitals and health providers to provide this kind of care.
Not that you're going to be looking for blame here exactly, but accountability at
Some
least.
kind of accountability, some kind of monitoring or internal process where cases of harmed infants or bad outcomes are not only reviewed, but where there's some kind of negative incentive. I don't know. From at least health professionals who've spoken to me, who are actively describing what it's like in their day-to-day work life, there are few repercussions.
No justice for the patients either.
That's right, no justice. And then, of course, the only justice that they can get requires major effort, major emotional and financial investment into a lawsuit that itself kind of re-victimizes them. In my state, actually, there's a case, a jaundice case, that was settled for like $40 million. And I'm sure this family deserved it. The level of care the disabled child requires for the rest of their life, not to mention the lost income and life, you can't even quantify it. You can't quantify it. But for a $20 carton of formula could have been prevented with that and a change in mindset.
So the 10-step initiative and the recommendations therein, it has all the appearance and all the trappings of something that's been considered, thought about, for the general good. So where are some of the issues, hurdles to making sure that what is actually being implemented is what's best for the patient, rather than just following the letter of the law?
The 10 steps originated in 1989, and it was the first kind of plan for the World Health Organization to promote breastfeeding. And if you think this 10 steps, there's a perception that the 10 steps has been, adequately vetted, that each step was tested for efficacy as well as safety. Well, that's not the case at all. It was put together, it was by expert opinion. I should mention that La Leche League International, which was the most prominent breastfeeding promotion organization at the time, were consultants, expert consultants to the initiation of the 10 steps. There are many things in there that, of course, are good things. The things that you cannot possibly say is wrong. So, number one, teaching parents how to breastfeed. Of course, we cannot promote breastfeeding without teaching how to breastfeed. Having a hospital policy, a written hospital policy about breastfeeding. I can't argue with that. But there are other things in the 10 steps that not only are not effective, but they are potentially dangerous to an infant. The most prominent of which being step 6, which is give no food or fluid other than breast milk unless medically indicated.
Now, if you listen to that, that sounds very reasonable. We don't want to give formula unnecessarily. It might ruin some breastfeeding. Who knows? We're trying to promote breastfeeding, so why would we be permissive of formula? Well, the devil is in the details. This unless medically indicated, most people will read that and think, oh, they are some special children with special dietary needs or medical conditions that make breastfeeding not advisable. But what few parents understand is that, quote, unless medically indicated includes complications of not getting enough milk while exclusively breastfeeding. And this is really the core of our work, because this is the trapping that most families who experience complications as a result of the Baby Friendly Hospital Initiative fall into. So, unless medically indicated, includes dehydration, excessive jaundice, hypoglycemia, hypernatremia, all complications of not getting enough milk while exclusively breastfeeding. And the most common time that occurs is in the immediate postpartum period before full milk comes in. So the reason why my organization take up so much issue with this particular step is that this is the primary metric that hospitals are operating under. At least in the US, there's a hospital metric called the perinatal core measure 5, which is essentially step 6. And it measures the number of babies who are exclusively breastfed, in other words, no formula was given to them unless there was a medical indication upon discharge. So, how does that play out in real life? Well, there are often babies who are not satisfied and not adequately fed or hydrated by colostrum alone, what their mothers produce. Mothers either don't produce enough colostrum, the colostrum is not adequate to meet their nutritional needs, and they will cry and cry, nurse and cry, and nurse and cry all through the night. And parents will reasonably look at this and think, my child is hungry. They're not getting enough to eat. And sometimes they'll even pump. Maybe someone will give them a pump, or they brought their own pump, and they will observe that they have either little to no milk coming out of the breast because it has not come in yet. And there is this mythology that drops of colostrum is enough to feed the vast majority of babies, and there's nothing to worry about when their baby is showing these signs, when in fact these signs are the earliest signs of a child developing complications of getting inadequate feeding. And so this is where, this is what we've discussed, as far as parents not receiving adequate information about the risks and benefits of their feeding methods, and they're not being adequately or safely counseled on how to feed their babies, since there's this external metric that is based off of step 6, one of the 10 steps, that pushes hospitals to avoid formula supplementation even when a child is crying for additional milk. Really, not just formula, just any milk, human milk or formula. When they're communicating to the world that they need more milk, they're being denied this formula. They're denied supplementation at their risk. They are being put at risk for these complications without the parents being told that there are these risks. But for a child to suffer 2 to 3 days of hunger and eventually pass away from not getting food because their parents were told something that they were told and that they thought was for the best, and then they followed it, and then this happens. It's just, and this is just the one story that got publicity. There are a few more stories that have been published. Well, I know one in the UK. Well, actually, a couple in the UK, and there have been people who've sent stories to us, and we published on our blog. But then there are those who I am aware of from my communications with doctors and experts, jaundice experts in the developing world, babies who die and have severe debility from this exact entity day in, day out, because there is many people don't deliver in hospitals. They get zero monitoring for jaundice or weight loss or dehydration, nothing. And then they come in when their child is obviously medically ill, kind of like Landon Johnson. And by the time they get there, it's just too late. The case fatality ratio for jaundice in the developing world is far higher than in the developed world. And But they don't get the press because they're in a low middle income country. They don't. There's no justice. There's absolutely no justice for those families who have to deal with the lifetime disability of a child with even fewer resources than we have for disabled children.
We've talked a lot about kind of policy content, but to think in terms of biological content, what is the molecular makeup of breast milk, and what is the consequence of its absence? And then is formula an adequate supplement in the short term, in the long term?
Starting off with breast milk. So the first milk that comes through is colostrum. It is a small volume of breast milk. It has been studied. The contents of colostrum has 54 kilocalories. I'm going to interchange. Most people understand calories, but scientifically it's a kilocalorie. But anyway, but I'm going to say calories. So colostrum has 54 calories per deciliter. And mature breast milk, which is the milk that comes, after 2 to 3 days, the full mature breast milk has about 66, anywhere from 66 to 77 calories per deciliter. That mature breast milk is what formula is fashioned after, is designed to mimic. Formula has 66 calories per deciliter. That's the starting point. Okay. Fluid is fluid. Water is water. There's no difference between the water in breast milk and the water in formula. It's H2O. And then now you get to proteins and fat. So formula is made from cow's milk generally. Cow's milk is lower in carbohydrates than breast milk. And so therefore, cow's milk has to be adjusted, and you have to add carbohydrates to cow's milk in order to match the carbohydrate content of breast milk. The primary carbohydrate in breast milk and formula is lactose. Similarly, protein content, cow's milk has a higher protein content than breast milk. And so it has to be adjusted for that. And then, of course, there's fat. So, those are the macronutrients. Calories and fat provide energy, and the protein provides the building blocks to create muscles and vital organs and all of that, so on and so forth. And then there's all the micronutrients. Now, we are often told that breast milk is the perfect milk. Okay, anyone who actually knows what's in those types of breast milk and formula knows that's not exactly correct, but doesn't mean it isn't a good source of nutrition. Okay, it just means we need to supplement. Already, we have to supplement breast milk. So it has been found that breast milk is relatively deficient in vitamin D. And vitamin D is important for bone growth. So therefore, any child, and that is not the case for formula because it's supplemented. So any child who's receiving either exclusive breast milk or up to half of their dietary intake consists of breast milk, has to be supplemented with vitamin D pretty much upon the first follow-up appointment after discharge from the hospital. So the vitamin D drops, something like that. Okay. And then in addition, breast milk is relatively deficient in iron. So newborns, term infants have an iron store from birth. But at around 4 months, we've seen that exclusively breastfed babies are at much higher risk of developing iron deficiency from that low iron content in breast milk. So infants who are exclusively breastfed or half-fed human milk at 4 months, it is recommended that they get iron supplementation. That does not apply to formula-fed babies. Now, when we're talking about the content, right, that is just what it has. That's reality. Some people feel that when you say things like, well, breast milk doesn't have this or that, you're being down on breast milk. That's not the case. Breast milk saves lives, but so does formula. Now, what formula doesn't have are immune factors that are present in breast milk. So there are IgA, which are antibodies that can essentially line the gastrointestinal tract of infants, maybe to some extent the respiratory tract, at least the upper respiratory tract of infants. And that is thought to be protective against respiratory and GI bugs, which the what is borne out in the data. The PROBIT trial showed that there was a reduction in gastrointestinal and respiratory infections in the infants who were in the intervention arm, so who got breastfeeding intervention. So there may be a true population effect of breastfeeding on reducing those infections, but about everything else that we're often told is reduced by breastfeeding, diabetes, hypertension, low IQ, all those things do not bear out in the PROBIT study. So in a well-controlled study, those do not bear out. Only in observational studies where the outcomes can be affected by things that are not related to breast milk, like household income, parental education, access to healthcare, access to, educational resources, all these things, and health-seeking behavior. Differences in health-seeking behavior cannot be parsed out in observational studies, but they do show that breastfed babies, babies who are breastfed or breastfeeding households, do better with regard to multiple outcomes. What is that from privilege? Is that from breast milk? Hard to say. But when you look at siblings who come from the same household, those differences disappear. Breastfed and formula-fed babies who come from the same household have the same health outcomes. So hopefully that will be, like a bomb for many parents, because there's so many ways to feed your baby. If your baby is fed, then you're doing great. You are doing great.
Having a sibling is the perfect A-B trial of different circumstance, different outcome, or...
Exactly. And unfortunately, this whole debate really plays on the insecurities of most parents. We all want the best. I mean, any reasonable, loving parent wants the best for their child. And if you're being told that this is the only way to give your child the best, and a giving formula is going to ruin them for life, you're going to believe them. And especially if it comes from a reputable organization like the World Health Organization, you're going to believe them. And if they don't tell you details like hypernatremia and jaundice and hypoglycemia as risks, you believe that too. You believe that it's maybe of not any consequence to my child, even if it becomes so. And there are families who are living out these consequences. I mean, it seems very abstract for, oh, well, you heard about this case or that case. Oh, poor, that's an unfortunate outcome. But there are families who are living every day with these outcomes. And maybe it may not be disability or long-term disability or something as dramatic or as a death of an infant, which has happened as well. But even just the suffering that a mother experiences because she feels that her body is not meeting up to the societal expectation of what she can and should do for her child. And no one wants to hear that they can't provide their child the best. No one wants to hear that. And so it is a very common finding in the parents we support where they have foregone sleep and taking care of themselves. Their mental health is in the dumpster because they're spending all their time in front of a pump to try to reach this unattainable goal for them. It doesn't even make sense. I speak from experience because I was there. I experienced that. And yeah, you were there. I mean, countless parents have silently suffered this experience, and it's not right to have options that can lead to the best outcomes, where you are recognizing the biology and the social circumstances of an individual family and coming up with the best solution. Maybe it's a combination of breast milk or formula. Maybe it's just formula alone. What works best for a family is a child that's fed, a mom, father, family that is working well and is getting sleep, and a whole family that is thriving as a result of their parenting regimen. And we have forgotten that. But that is the most important goal.
Which is why the Fed is Best Foundation has come to be, I suppose. Can you tell us all about the resources, the information available there, and what kind of platform you are providing for parents, for people going through childbirth and child rearing, but also for clinicians and also for educators?
Fedisbest.org is where our platform mostly exists. It is a treasure trove of parent stories, people who have sent us their own personal stories of problems as well as successes with feeding their babies with either breastfeeding alone, combination feeding, temporary supplementation till they are able to exclusively breastfeed, formula feeding alone, deciding, or exclusive pumping, all sorts of different stories that come from real people to tell you what the reality of it is. And then also from health professionals, things that health professionals have witnessed in hospitals as a result of the current paradigm. And so there are real stories there. And then we, from these stories and from our review of pretty much everything that has ever been written about infant feeding and feeding complications, insufficient feeding complications, we've developed articles, guidelines, multiple resources to help parents know whether or not their babies are getting adequately fed. That includes daily milk calculator. For any age child you have, you can put their weight, their age, their male, female, or so on and so forth, and can come up with how much they need in a day. This applies to both breastfeeding and formula feeding families. Any milk, either of those, they need that amount per day. And then signs of inadequate feeding, what normal labs are. I have lectures on there, a link to the newborn weight loss tool, which is what helps guide normal versus abnormal weight loss with some caveats. We also have social media. Right now, our largest platform is Facebook. I understand social media is evolving and there are other places where people spend their time. But right now we're on Facebook and we have a Facebook group and we screen and admit people into our parenting group and people give each other support and, our moderators are health professionals. So we make sure that anything that is either posted or responded to in our group is sound advice, supportive, non-judgmental. And right now we are in the middle of writing the Fed is Best book. So we have a book scheduled to be published in June 2024, Fed is Best Guide. And there's a full title. I don't need to, but at some point it'll be out. We also have a health professional group on Facebook for people to vent about the things that are happening in their hospitals and policies and how they can kind of advocate for their patients and maybe change hospital policies to make it safer for all babies. So those are the resources we have at this time.
How do you remove yourself from the constancy of this work?
That's the thing. It's just you just have to, you do what you have to, I guess. When you're a parent, and, and when something is necessary, you just do it. It's not a question of how, it's just you do, because there are people who rely on you to be put together. People rely on you to keep moving forward, and it's just not only my child, but other people's children that rely on this work. And they may be a minority, but it's an important minority. It is something that shouldn't happen. It should never happen, ever. And yet it is. And so you keep doing it because you have to.
Where can people find more, and what would your message be to, the different strata of public, professional, and policy? What do people need to know in their family and for all families?
From a health policy perspective, we need more messaging to parents and health professionals at large the importance of adequate feeding. That the most important goal of breastfeeding and formula feeding and combination feeding is making sure an infant is receiving their full caloric, fluid, and macronutrient and micronutrient requirements every day without interruption in a way that allows them to reach their full potential. So we need that message out. Number one. Number two, we need policymakers to face the reality that the population of mothers that they're creating policies for do not have as perfect milk supply as they have believed. And that they need to face the reality that if that is the case, and that it is common to find that in the population, that is the case, that mother needs to be encouraged to supplement as needed, period. That is her right, her child's right to be fed. And if you don't provide the education or the permission, essentially, for her to feed her child what they need, whether it be breast milk and formula or formula alone, then that message will result in a child who does not get adequate nutrition. And then number 3, from a global health policy, we need better monitoring of infant feeding parameters. So right now, the subject of my paper is fetal hypernatremia, but there is a much larger population of infants who are experiencing hypernatremia that goes unrecognized. In a study of universally screened term newborn infants, a mixed cohort of breastfed, mixed fed, and formula fed infants, it was found that more than a third of infants met criteria for hypernatremia. So sodium of greater than 145 is hypernatremia, and that is by definition dehydration, and it is an indication for supplementation. At a sodium of 150 and above, it has been found in a study of 100 infants that were recruited consecutively and offered brain MRI. 94 infants received that brain MRI. An astounding 42% had lesions on MRI consistent with injury.
So almost half there.
Yeah, almost half. And right now, people believe that hypernatremia only occurs above 10% or 15% or 20% of these high extreme weight loss. It is found in that study that hypernatremia is occurring as early as 4.8% weight loss. So these newer studies, we are looking at the complication rates that are occurring as a result of our global health policy. They are showing that there is an unacceptably high complication rate. And this is a major oversight in health policy. And then not to mention the now 30% of infants who are developing hyperbilirubinemia or excessive jaundice that only occurred to 6% of infants before the Baby-Friendly Hospital Initiative. So this is a problem that did not exist before this initiative. And now we're here and we're not doing enough to prevent it. And they may look fine going out of the hospital. They may look fine after they get supplemented. It doesn't mean that they're fine in the years following. There is a problem. Families are experiencing it, and they're going on to live out the consequences of this flawed policy. Now, from a hospital perspective, these are the things we can do. We need more frequent weighing of infants. We need every 12-hour weighing of infants because that's when they experience the greatest weight loss, the time from birth to about 3 to 4 days until milk comes in. Parents need to be taught to weigh their babies until their milk comes in as at home with home baby scales, because that could potentially be life-saving as well. Because if they see that there's excessive weight loss at home, then they can initiate supplementation that can prevent these serious complications. Exclusively breastfed babies need glucose monitoring because they are receiving a fraction of their caloric requirement. The data shows that exclusively breastfed babies' glucose levels are gradually declining until milk comes in. And if they reach a threshold below, let's say 47, 45, those numbers have been associated with higher risk of developmental disabilities. The lower, the worse. The lower they are, the worse the outcomes. And the more prolonged the hypoglycemia, the worse the outcomes. And then lastly, we need more aggressive policies for preventing jaundice with formula supplementation. We have supplemented babies or donor breast milk if it's available. Fed is fed is fed is fed. It does not matter. If you have a safe alternative like donor breast milk or formula to feed it to prevent a child's dehydration, jaundice, or hypoglycemia, feed it and then promote the breastfeeding. Worry about the breastfeeding at that point. There are many ways to keep up the stimulation for breast milk production without forcing a child to nurse day and night for hours at a time, losing weight during it, okay? And without forcing a mother to lose sleep, okay? If you pump in place of a feeding, that can provide adequate stimulation for breast milk production. If you're making sure a mother is feeding at least every 3 hours and pumping maybe 15 minutes each time, you can make sure there's enough stimulation to promote milk production. And most of all, we need policies that take care of the mom. So because of this policy, mothers are often forced to go without sleep, not only for the 24, 30 hours, however long it takes to deliver the baby, but the 3 to 4 days after that, when the baby's crying nonstop, nursing nonstop, putting the child at risk of accidental bed sharing when the mom falls asleep during breastfeeding or skin to skin, and causing episodes. I mean, babies have literally died from this. They have suffocated at their mother's breast because their mothers have been too exhausted to stay awake. Through no fault of their own. This is a policy adverse effect. This is ridiculous. The 10 steps has become a hazing ritual. And it has negative effects that we are not fully informing parents of. We are following a 10-step that's become essentially transmutated into a 10 commandments of breastfeeding, to the point where in 2007, when 2 of the policies were actually abandoned by the World Health Organization expert panel, namely avoiding bottles and teats, nipples, was abandoned by the expert recommendation based on lack of evidence. And the no pacifier recommendation, that was also abandoned based on lack of evidence of promoting breastfeeding, and also a pacifier use decreases the use of SIDS. So those 2 things were abandoned. But Baby Friendly USA has retained the recommendations despite their expert recommendations at the World Health Organization, because of this belief that the 10 steps have to be retained and kept together. I mean, it is religious thinking. It is zealotry. I mean, here you are, something that is not actually helping and potentially harming infants by increasing rates of SIDS, and you want to retain it just because science. It's not scientific thinking. That is not evidence-based. That's not even pro-baby. That's just pro-10 steps.
It's certainly not good care.
It is not good care. It is not good care. And to promote it as the only way to provide good care to infants while effectively hiding the risks associated with it from parents, it is, again, negligence, absolute negligence.
We'll put all the links that we can to the Fed is Best resources in the episode description that goes with this. And Dr. Castillo-Hegyi, please keep on fighting the good fight for all of the babies and mothers and tired fathers out there as well.
Thank you. Thank you. Absolutely. I will.